I did my fellowship from Mount Sinai Hospital in New York, a couple of fellowships, and working currently as a professor of cardiology, Sri Ramachandra Institute of Higher Education and Research. Uh, it's a passion to be a cardiologist. That's what I used to tell my students. There are many other professions through which we can save lives, but the pleasure what we get by salvaging a patient who is about to die because of heart attack is immense. It's immense. So who are watching this, who wants to take medicine as their profession, they should go ahead.
Okay, thank you so much, Dr. Boopathy. So just a few questions that many of these people have asked. So the first question is, how can we track blood pressure?
Uh, how can you track the blood pressure? So one of the most important thing is the target blood pressure. When you see your physician, you should ask what exactly is the target that he is trying to achieve for your health. In general, it varies from age, one person's age to other person's age. In general, if the patient is going to be quite elderly, we try to keep a blood pressure target of less than 140/90. If the patient is quite young, less than 75, we try to keep a blood pressure target of less than 130/80. Lower the blood pressure is better the outcome. However, that should not come at the cost of health. If you are having a postural dizziness, you are getting up from your blood, you are not able to stand straight, you are having dizziness, that means you are not tolerating that lower blood pressure. That means you have to meet your physician so that your blood pressure can be reduced. Some of my patients, they can't tolerate a blood pressure of even 140, so we have to keep a higher blood pressure on them. Their body is adapted to the blood pressure, but it's quite rare to have such a situation. In general, we could most of the patients can tolerate a blood pressure kind of 120, 110 to 130 of systolic, and a kind of 60 to 80 diastolic. It's feasible to tolerate such blood pressure. And then tracking the blood pressure, we have stopped using mercury manometer these days. Currently, it's only aneroid or automatic blood pressure oscillometry systems. It's available, but it's produced by different companies. There are few things that we need to ensure before checking the blood pressure. Ideally, it should be measured in the same hand, preferably right or left hand, and it should be the same hand. There can be a difference of less than 10 millimeter blood pressure between right and left upper hands. So it is right and left upper limbs ideally. You should not measure the blood pressure from forearms. We are not calibrated for the same. Whatever outcomes are based on the arm blood pressure. So don't trust the forearm blood pressure, number one. Number two, when you put keep the blood pressure equipment, you should be sitting straight in a chair like this. You should not be dancing like this. You should be sitting straight, and your legs should be touching the floor, and preferably hands should have a support on a desk like this. And you should sit in the chair exactly like this for 5 minutes and check the blood pressure and note it down. Before checking the blood pressure, you should not, and no one should not have smoke for 30 minutes at least, no coffee for 30 minutes, no caffeine item for 30 minutes, no food for 30 minutes. And once you get up from the morning, after peeing or voiding, you should check the blood pressure. Having pee inside the bladder, urinary bladder, increases your blood pressure. So this is the way how blood pressure needs to be checked, tracked. This could easily be done at home. This is the cheapest thing next to quitting smoking that can save lives.
Thank you so much, Doctor. The next question we have from is, how does obesity impact heart health?
Yeah, that's a good question. Obesity impacts heart health by means of multiple things. Number one, obesity makes a patient prone for all the risk factors that are making an individual that is predisposing an individual to develop heart problem, like diabetes mellitus, high blood pressure, dyslipidemia, and having obesity, especially abdominal obesity, has been shown to be a risk factor for both stroke and heart problem. If you are going to have significant obesity, that makes an individual to snore a lot, and ultimately he will develop obstructive sleep apnea syndrome, and that may have significant impact on the heart also. So it is not one reason why obesity is a problem to heart. It's multiple reasons. Having said that, I'm not obese. Am I immune to heart problem? Absolutely no. Because heart problem happens because of multiple problems. You take out one problem alone, you can have some other problem. If you continue smoking, you will have heart problem, irrespective of not being obese.
Thank you, doctor, for your answer. The next question is, how does salt intake affect heart health?
Beg your pardon? How can?
Salt intake.
Yeah, salt intake, sweet salt, not having good sweat, are the three reasons, three important reasons for having heart problems. Higher the salt intake, higher the blood pressure, and it is basically blood pressure that's the most important thing for both stroke and heart attack. That comes second or third in line after cholesterol. So in general, we tell our patients, do not reduce your salt intake if you are having no blood pressure. If you're having blood pressure, we tell them, don't take added salts. Don't take food which are rich in salts like popcorn, pickle, biscuits. These are all rich in salts. Avoid them. And if you're having a heart problem with reduced pumping function, we in general tell them to decrease the salt by 50%, but not that though it has not been shown to have evidence strongly, this helps the patient to have less fluid overload in their body system. That's it. We tell them in general it's recommended to have less than 4 grams. However, we can't measure less than 4 grams. And trust me, all of us take more than 10 grams. A normal average Indian diet, we consume more than 10 grams of salt. Trust me. So that means we have to reduce the salt intake by more than 50% by all means.
Okay, so the next question we have is it true that women are at lower risk for heart attacks than men?
That's partly true, partly false. You want to hear the false or you want to hear the true?
I think we'll hear both parts.
Both parts. Okay, let
Yeah.
me be true first. It's true because women before their menopause have reduced risk to have heart problem. That doesn't mean they are immune to have heart problem. Women after menopause have risk equivalent to men as compared for heart diseases. Having said that, I have seen women today in my outpatient clinic today morning. I saw a patient who had a heart attack at the age of 36. That's it. She had a severe blockage. So we have actually a high threshold to diagnose heart problem in a younger woman. Luckily, she got diagnosed. Maybe our lifestyle is changing completely. Whatever we have been read, it's not actually true for the current generation. One of my professors used to say, we read about the people, read about diseases prevalent in the past. We are living in the present for the future diseases. Unfortunately, it's constantly changing. So we need to update. So to conclude your statement, yes, women are definitely has got a lower risk for heart problem as compared to men. In previous generation, it's completely true. It's the difference is coming down drastically in current generation. And maybe if you meet again after 10 decades, I would say, I wish I'm not going to say women are equal at risk even before their menopause.
So not a question, but just based from your experience, like what is like the incidence of heart attacks that you're like seeing nowadays?
That's a good question. It's pathetic to see. I was telling you about the woman, am I right? When they entered with the family, a old man, 72-year-old came, said my outpatient clinic. I thought, sir, please come sit. வாங்க உட்காருங்க. Then I realized he brought his daughter with the problem. It's sickening to see kind of sons and daughters are brought by parents rather than parents with heart attack brought by sons or daughters. I hope you got what I'm trying to say. The role is reversed here. It's sickening to see I really don't know why it's happening. Possibly because of significant lifestyle modification that includes pollution, the way we live, way we eat, what we breathe, all matters. I would say today I've done 4 angioplasties. That is removing the blockage and putting stents. One patient is 67 years. The second patient was maybe 55. Third one is 39. Third one is 39 is a pathetic one. The fourth one was 64-year-old female. So all these patients had a heart attack. So since I'm working in a medical college, it's a high volume center. Whatever I'm stating cannot be extrapolated to community. However, the Indian data says the prevalence of CAD, coronary artery disease, is something around 3 to 5% in general population. But as the age increases, it increases. The prevalence of diabetes and high blood pressure, which are the 2 important parameter for heart disease, varies from 25 to 35% in India at present.
So
And
we have
to
a,
tell
oh,
you
sorry.
something, having moved to US doesn't change your gene. So all you guys that living abroad, bit of not having less polluted air, all our genes are not clean. It's only South Asian race that has been given 1.5 times, 150% increased risk to have CAD. So please be aware of it and sure take care of your health.
So we have a similar question relating to what you just said. So do you think that it's mainly the diet that's affecting like this increased rate of heart attacks? Someone asked, will eating a normal South Indian food like rice, dosa, etc., cause heart disease?
That's a great question. So to put forth your question is, does the South Indian food is a risk for is a risk for heart problem? Absolutely, I would say uh, no. It is what you eat. It is not what you eat. It is not. It's how much you eat that matters. That's the most important. If you ask me, is rice a better food than millet? No, millet is definitely a better food. It has got a very low index. So it gives good lower amount of calories for the same amount of weightage of food as compared to rice. However, we don't like millet means you don't like. You want, we're all living in this world to have some fun, am I right? So have food what you like, but take it in less quantity. That is the most important thing. And if you want to take more food, skip the next food. It doesn't matter. Skip your next food and do good amount of activities to burn the calorie what you have taken. It all depends on what you take and what you give it out. Amount of calories what you give it out is the expenditure is going to be higher. Ultimately, you won't gain weight. You won't become a pre-diabetic. You won't become a guy with metabolic syndrome. So to answer your question simply, it is the amount rather than price.
Okay, I understand. So when we are like looking at what we should eat, should we be looking? So nowadays everyone is saying like look at the carbs, level of carbs, fibers, proteins, etc. Should we be looking at all that or simply like the number of calories? Does it make much difference?
That makes difference actually. Any food that has got more protein may not be palatable. Trust me. I have tasted good number of foods. Since it's an informal discussion, I'm telling. I wish most of us can take to one gram per kg of body weight of proteins. Most of us are not taking include me. We are not taking protein, that much amount of protein. Our taste buds and tongues are not tuned for protein. To take higher protein rich liquids, you can taste that. There will be some bitterness. Unfortunately, those proteins and bitterness are essential for life. So if you take most of your calories by means of carbohydrates or fat, that is going to give a bigger problem. If you take most of your calories by means of proteins, that is going to give less problem. And it is essential, it is quintessential for us to have 1 gram per kg per day of protein by means of anything, by means of liquid or your food, anything. It's essential. So Ensure you take good amount of protein. In general, you should have 50 to 55% of calories should be from carb. Carb is essential for life. If you take lesser carb, I mean, there can be other consequences. I would say another 25 to 30% should be from your fats and rest from protein. It is good to have more protein, but as I told earlier, most of our South Indian foods are not made for the same.
Okay, so I'll go back to the questions that many people asked. So someone asked, how is blood pressure impacted by hours of sleep? What is the recommended hours of sleep for each age group? And what are the alternate options for those that cannot maintain the recommended sleeping hours?
Yeah, the recommended hours of sleep varies from individual to individual. Let's focus on adults. Since I am not a pediatrician, for a healthy adult, there are studies that clearly says that we should sleep between 7 to 9 hours. That's very essential. Having less sleep is a risk factor to have heart problems. Any sleep less than 6 hours or more than 9 hours are equally prone to develop heart problem. Less than 6 hours, more stress. More than 9 hours, more laziness to have heart problems. It is not only the sleep duration, it is also the sleep timing that matters. There are studies that compare people who are going to office in the night time and basically owls versus birds. Most of us are birds, some of us are owls. So it's their lifestyle. They compared it, found that owls have got higher problem chances to have higher heart problem as compared to birds like us. And so, from point number two, point number three, in addition to duration and fat and the timing of sleep, another thing that's important is the intensity of sleep. I'm living on the blood, but I didn't go to good sleep, deep sleep. That means you will be having non-refreshing sleep and day next time. So one of the important reasons to have non-refreshing sleep is obstructive sleep apnea. Once you have non-refreshing sleep, during the next day, you will be having some kind of headache, non-refreshness that leads to activation of sympathetic system in your body. Ultimately, that increases your blood pressure. In the chronic process, if it is 1 day, 2 days, it's okay. If it's going to last for a longer time, it will definitely create health-related problems. And it has been clearly said an important risk factor, irrespective of having diabetes or not having diabetes, irrespective of other risk factors, having a poor sleep duration, poor sleep timing, poor sleep intensity are risk factors for CAD, cardiovascular or coronary disease.
So you mentioned how having like fewer than 6 hours can be like a cause for stress, which in like can cause health issues. So how do you how exactly does stress impact heart health, and like how can we manage it? Because I'm sure that like many of like the younger people that are having heart issues, it might be like due to stress. And yeah.
Yeah, there are different ways of handling stress. Though I'm not a psychiatrist or psychologist, I'm in a good position of my life to help you guys. Number one is identify a thing that gives you happiness. For example, three things that give me immense amount of happiness is playing basketball. Number one, watching movies. Number two, I'm a foodie, going to different restaurants and trying it out. And beware, be conscious about it. If you go to a restaurant, come back and play something. Okay, you should be getting those calories out of your body. So take those stresses out by doing what you like. That's the most important thing. If you are a believer of yoga, start doing yoga. And we are doing, there are good amount of evidence that says that the yoga which originated from India definitely helps to reduce stress by all means. And try to have a good social life with your friends. It has been clearly when studied and proven that people who have a lot of friends have got a low stress life that leads to higher higher survival chances compared to people who do not have good number of friends.
So what exactly is the correlation between the stress and like heart health?
Yes, there's a good amount of correlation. most of the stresses we consider. There's a study by name Interheart. Interheart is a study conducted across the world in 55 countries, where they try to identify what is the risk factors for heart problem in such low middle income countries. The risk factors, one of the risk factors was having stress. So it's directly linked to heart problem. Having stress doesn't mean mental stress. It means physical stress also. Undue physical stress. For example, I have not gone to gym for in my life again. Suddenly, I want to lose weight and going to gym and lifting tagal, lifting weights. That's undue stress. That's not good for your health. Anything a child born from mother's womb will start its activities gradually. It's turn down, then it's walk with support, then walk without support, then start running. Then toddlers say, then does everything. Our life is like that. You want to lose weight, go at a slow, steady pace rather than at a spike, ups and downs. That's not going to happen. It can create harm to you also. Any stress activity stimulates your sympathetic system, and one of the important reasons for heart-related ailments is having higher sympathetic system. And your left ear should be ready to let out things when you hear from the right ear. Don't get anger. Hear this in this right ear and let it down to your left ear. As Buddha has rightly told, anger is like consuming poison and expecting others to die. If we get anger, it's not going to affect the other person. It's only we who are going to get affected.
Thank you so much, doctor. So another
I hope
question
you
we
guys
had.
don't mind me sipping a tea.
No,
It's
no,
tea
you
time
go
for
ahead.
me.
So another question was, how can I know if I'm at risk for heart problems in the future, and how can I evaluate that risk at a young age?
At a young age, good. One thing which I would promote is telling our kids that try to be healthy from childhood. That's the most important thing. And taking out those iPads. How many hours do you watch iPads? Not now, 2 years before.
Quite a lot, yeah.
Quite a lot of it, right? So those times you should have gone out playing some kind of outdoor activities rather than looking at iPads. Our generation we used to play a lot, and my kids' generation they do play, but absolutely I would say only I would say maximum 30% of what we played. During weekends we used to go out, play cricket, whatever it is, we play, and nothing like this happens these days. I would encourage the youngsters who are listening in this particular program. Uh, if you read for 2 hours in a day, spend 30 minutes. The ratio should be at least 4:1 to 5:1. 30 minutes having outdoor activity, not indoor activity. You guys are, the next generation is definitely sharper than the previous generation. That is the reason of, that is the basic concept of evolution. Whatever it is, the next generation will be sharper than the previous generation. That is Darwin's theory. It is good. That is the reason how we are all coming out. So spend more time doing outdoor activities, play, do something, lift weights. That is more than enough. If you focus that on that, in addition to it, those French fries has got a lot of trans fatty acids. All of you watching here, including me, eat it. Okay, so eat less. Maybe once in 2 weeks maximum, once in a month, if not once in 3 weeks. That's something like that. Keep a full stop. Okay, I should not have this. Those are all. I read a book by Chetan Bhagat in last month. It's called as 11 Rules for Successful Life. It's a wonderful book. One important thing what he says is having not to try to have short dopamines. This dopamine is the important thing that is secreted inside our brain that gives pleasure. If I do something happily, that means this, dopamine is a chemical transmitter that is secreted inside a part of our brain called as basal ganglia. If dopamine increases, I will get elated. Dopamine decreases, I will get depressed. So there's something called as, he uses the word called as short-lasting dopamine. So all these things that gives short pleasure increases dopamine inside our brain. So once you you start continuously doing it, the threshold to have that pressure gradually is initially you will eat 2 French fries, then 10 fries, then one pack in 1 month, then it comes down to 2 weeks once, then it comes to 1 week once, then it comes daily. Absolutely harmful. So I would say 3 points for the kids. Other than focusing on your education and future, health is foremost important thing. நான்லாம் படிக்கிறப்ப people used to say சுவர் இருந்தாதான் சித்திரம் வரைய முடியும். So I have to tell the same thing. I can't translate in English. Those who can understand Tamil, please understand it. So you have healthy to achieve your goal. Sleep properly, for proper sleep for 7 hours. Do outdoor activities 30 minutes a day. Forget about anything. 30 minutes a day outdoor activity. Do some exercise. Go outside your home. Play with your friends. Go to gym. It can be indoor gym. That doesn't matter. But you should be out of your home for 30 minutes. Be conscious about your food, what you are taking, and avoid short-lasting dopamine pleasures. It's not going to help you at all.
So when you talk about the French fries, it reminds me. So like, can you explain the difference between like the good and bad cholesterol?
Okay, that's my favorite question. So our body is made up of chemicals. We are nothing but amalgamation of multiple chemicals. Cholesterol is one important thing that is produced by liver primarily, produced by other organs also. Mota in the sense big. If I want to tell in a broader way, the cholesterol can be classified as good cholesterol, bad cholesterol. If the cholesterol goes out of liver, so that is essential for many organs. We are standing because of a hormone called as cortisol that is produced from cholesterol. So that cholesterol is essential. How much cholesterol is essential is our body liver doesn't know. Constantly produces cholesterol and sends outside our body. If all the cholesterol that goes, once the necessary need is done, it will get converted or deposited on the way en route, that is blood vessel. So they are transmitted from the liver to the peripheral system like muscle or everywhere as cholesterol called as VLDL, very low density lipoprotein. So that VLDL en route can convert into IDL, en route can convert to LDL. The LDL is a dangerous thing. In addition to going to the respective organs where they need to get converted into different hormones, utilized for purpose of different hormones, it also gets deposited on the vessel wall. As the vessel wall gets deposited on the vessel wall gets narrowed and it leads to blockages. It can lead to blockage inside the brain vessel, inside the heart vessel, or the blood vessel that takes blood to the legs. So those cholesterol needs to be removed and taken back to the liver so that it comes out of our intestines as stools. That process done by HDL, high density lipoprotein. So to summarize, LDL, low density lipoprotein, is the worst bad cholesterol. HDL, high density lipoprotein, is the good cholesterol.
Okay, thank you. So another question that someone asked, they said, are there any mild medicines to be taken after 40 plus years to decrease the risk of heart issues or heart attack?
Can you repeat it? After 40 plus years?
Is there any mild like medications that can be taken to reduce the risk of heart issues?
Yeah. After 40 years, since you are in US, there's something called as ASCVD, atherosclerotic cardiovascular disease risk calculator, that is provided by American College of Cardiology. So you can calculate the risk per annum risk, 10-year risk, and lifetime risk without a heart problem. If the risk is going to be more than 7.5%, 10-year risk, then better to take a drug called as statin. Statin decreases LDL. That is the bad cholesterol. But all these things has to be done by a physician. Don't do it on your own.
So when you talk about the risk of heart issues, how significant is that the role of genetics rather than the other environmental factors, do you think?
Yeah, role of genetics cannot be modified actually. I can't change my parents. So you can't change your genes. You are destined to live with the gene. But the sound is not produced by this hand alone. Sound is produced by these two hands. So genetics are bad. Control the environment. which is achievable. Yes, genetics plays a significant factor. However, by manipulating our environment, we can reduce the risk of CV.
Okay, got it. Thank you. So someone asked, what is the APOB test, and should people start taking this test from the age of 30 and onward?
The APOP test, it's we don't call it as the APOP test. It's the ApoB. ApoB is nothing but ApoB includes LDL, VLDL, IDL, all the cholesterol that carries ApoB 100 lipoprotein. It's a protein commonly seen in the bad cholesterol. I'm not suggesting ApoB 100 to all individuals. In individuals in whom LDL is achievable, LDL cholesterol is controlled, then we can check ApoB 100 to check whether we are in line with ApoB 100 also. Otherwise, it is not needed. If your LDL is very well controlled and if you don't have a heart problem, don't go for it. Something called as residual metabolic. This it's not needed for general population. It's only for individuals who have got heart problem.
So on a similar line, like, are there any like vitamins or supplements that can like help support heart health, do you think?
Yeah, there are good amount of evidence that has shown that vitamin health is not, but taking any vitamins has not shown to decrease the heart problem. There's good amount of evidence. I don't suggest my patients to take vitamin at all. Not at all in the sense it's not needed. If it is, it's not needed.
So things like the supplements or like protein powder that people nowadays are taking.
There's no
What are your-
evidence. There's no evidence.
Okay.
Cardiology is the I would say it's one of the toughest part of medicine where we don't do anything without evidence. If you want to give something, okay, even if the tea is good for health, we give this tea to 100 people and don't give to 100 people. We follow them for a couple of years, 3 years, 4 years. What exactly happened? Does having this tea make an impact on their life?
Mhm.
Then only we give it. Otherwise, we don't give it.
Mhm. So, like you said, like the things that people are taking nowadays, it's not really like shown to help. What are some other like kind of myths in like about heart health that you've maybe seen like WhatsApp or like in like social media that you know are not true, but many people are doing it thinking it to be true?
The most important thing I would say is quitting smoking. That is the generation. Maybe India is entering into the kind of westernized society's culture. I've seen both sexes smoking these days at a younger age. It's not good for health at all. That is the cheapest thing that we could do for ourselves, for our country, for our family. The second thing is keeping ourselves healthy. There's a large study that says that not doing 10,000 steps, doing 8,000 steps is good enough to keep your heart healthy. 7,000 steps, actually, not 8,000. If you do any 7,000 steps a day, your all-cause mortality, your chance to die because of any cause will automatically come down. If you do 8,000 steps, your chance to die because of heart problem comes down. And if you do more than 12,000 steps, that's no use. You might be healthy, but it's not going to impact your survival. So keep yourself fit. That's the second important thing. Third important thing, things comes and go. You have to let it go. Let's go with the flow. Don't take stress. And fourth one, find your passion, the job. Because most of the time you'll be doing it. The job is the most important thing. Yeah, in the sense you'll be spending most of your life, 2/3 of your life, doing a profession, or maybe 60%, if not 2/3. So identify the job that gives you immense pleasure, passion. Do it with passion. That's it.
So I think we have a question in the chat here. Someone said, talking about supplements for good bone health, we are being recommended to take vitamin D and calcium. Recent studies,
Those
I
things
was
are
reading.
different. Yeah, those things are different. I am a cardiologist, so I was focusing myself to heart-related ailments. Vitamin D is essential. I take vitamin D because I'm not going and getting exposed to myself to sun between 4 to 6 o'clock. so that my skin can produce vitamin D. Unfortunately, most of us are not doing it. So it's better to take vitamin D. Check your levels and take it, because we are not vitamin D cannot be produced by body without sun. It needs sun.
Yeah.
So
I think this person is saying, he was reading a study that like calcium supplements can harden the arteries. So for that,
uh,
they are suggesting vitamin
no,
K,
there's
D,
no role.
calcium.
There's no role. There's no evidence. Forget about it. Calcium, anything as I grow older and older, some of my hairs become gray or white. It's the same situation. If your plaque is going to, we call it as plaque. If the plaque is going to be there for a longer time, then gradually the calcium start depositing. If you're not taking good amount of calcium, you break your bone, and you may develop consequences because of fractures, and many individuals may not live that long to develop calcification inside the blood vessels.
Um, Same person also asked, is there any way to test how like hard or soft the arteries are, or like how healthy they are?
There are tests which are available, but it cannot be, it doesn't come free of cost. There are radiation exposure is there. So unless it is warranted, do not get it done. It's not needed. Be healthy, stay healthy, go to your doctor. There's no need to have a master level checkup. Go to a personal health check. At a certain age, you should get certain tests done. Get it done. You will be able to identify most of your problems.
So what are those said tests that you would recommend at
It
certain
varies
ages?
from age to age. It's different for a 25-year-old individual as compared to a 55-year-old individual.
Okay. Another question, can you explain what heart palpitations are and why and when they should be a concern?
Yeah, undue awareness of one's own heart rate is called as palpitation. If it comes suddenly and goes suddenly, it's arrhythmogenic. You need to meet your doctor. If it is exertional, it comes only during your exertion, then maybe it's common to all of us, called a decondition effect. If it is causing some syncope, that is, you are losing your consciousness, then you have to definitely meet your doctor. Or if it is bothering you a lot, meet your doctor.
Thank you, doctor. Another question we have is, how important is hydration for maintaining a healthy heart?
Yeah, taking good amount of fluid is essential for our heart. Our body is nothing but 70% of water. So we should have at least 2.5 to 3 liters of water per day to keep ourselves healthy.
So we also have some questions regarding COVID. So someone asked, there's many post corona, there's many younger fit people that have lost their lives due to cardiac arrest. They're asking why, and is it due to COVID vaccination?
The conflict of interest here. Okay, number one, any infection can precipitate stress that leads to heart attack. Yes, we observe more commonly with COVID infection also. Number two, vaccination. Some of the vaccinations, yes, there is a direct relation. Myself have seen heart attack after 3 weeks, stroke after 3 weeks. However, I've also seen 25-year-old die with COVID. It's always risk with benefit ratio, am I right? Life doesn't come free of cost. There's no freebies in life. Out of 1 lakh individual, 100,000 individual in US way, 1 or 2 individuals died because of heart problems or stroke. Out of 100 individuals, 10% people died with severe COVID. Now let's discuss, what should we take, vaccine or not? I have taken vaccine.
Okay. Thank you. So what about like if someone has already had a heart attack, what should they then be like cautious of? Like after their first attack, what should they be like watching?
Yeah, you have to follow the instructions told by your doctor. I used to tell our hand has got 5 fingers. This is common for all. The most important thing is thumb, that is exercise, half your food, increase your vegetable double, increase your food by double, reduce your stress by half. This is stress and this is exercise.
Okay, thank you, doctor. Another question we have is, is it risky for a heart patient if they undergo any surgery? This question specifically says ortho surgery, but any surgery generally.
Any surgery, if you are a heart patient, you have to meet your cardiologist to get the possible risk to have heart problem during the surgery. Any individual can develop heart attack during any kind of surgery. It varies from low risk to high risk. What is the risk that the particular patient's surgery puts him on has to be assessed by the cardiologist. It definitely goes higher if you are a heart patient, and the type of surgery what you undergo.
Okay, thank you, doctor. One more question is, so what is the impact of like the air pollution on, like, how does that affect our heart health?
Air pollution is a new diabetes. That's it. Diabetes, blood pressure causes heart problem. Trust me, air pollution causes heart problem. There's a good amount of evidence. There's no question. Because we have to work hard to reduce it.
So when we're working hard to reduce it, is there any like specific exercises or things like that that you think could particularly benefit heart health specifically?
There is nothing like that. Whatever exercise you like. For example, I don't like doing weightlifting. I like jogging, and I like playing basketball. So these are all things what I do in my life. If you like swimming, go for it. Higher the age, higher the chance to have bone related problem. So go for milder exercises but longer exercises. I meant longer duration.
Yeah, I understand. Thank you. So we have another question. What is cardiac rehabilitation and who should consider it?
Cardiac rehabilitation is one of the important field that is often not used appropriately. There's a specialty in the United States. It's developing in India. So all patients are not meant to do the same kind of activity as compared to another patient. It has to be tailored. A cardiac rehabilitation program tailors an individual health. Accordingly, it places, okay, you can do this much amount of steps in a day. This is the amount of maximum exercise that you can do. And if you're not able to do it, they will gradually escalate it and bring you to an appropriate level. Not doing cardiac rehabilitation is equivalent to not taking a pill essential for heart health.
Mm.
It's so important.
So is there an age for that or just?
There's no age for it.
Okay.
If you are able to walk, be able to get yourself rehabilitated. If you're not able to walk, that's a special kind of rehabilitation that can happen.
Got it. Okay. So how we know that you said like when you're taking BP and all, like you shouldn't drink caffeine before that. So nowadays, like a lot of people are drinking like tea, coffee, those things. So at what point is it like too much for the heart with the caffeine consumption?
Having caffeine consumption has got a dual role actually. If you take too much, it increases your blood pressure. If you take too much, then the blood pressure constantly remains higher. But a less lower intensity of caffeine has been shown to be heart healthy. It make you also awake. It increases your energy. It has been shown clearly to be a heart healthy thing, similar to a chocolate.
I think we have a new question. Someone asked for any tips to maintain a healthy heart for senior citizens.
Healthy heart for senior citizens.
Seniors, yeah.
Yeah, I told the 5 things.
Yeah.
Do the same. Whether
Mhm.
senior or junior is immaterial.
If anyone in the call now has any questions, feel free to ask in the chat or unmute and ask as well. Or I can keep going with any questions. Okay. So doctor, do you want to talk a little bit about oh, I think someone asked a question. This question says, I had heart attack 1 year before with 3 blocks and initially 1 stent placed. Later, I had surgery for 2 blockages. How can I maintain a diet that supports my recovery and overall heart health?
Yeah, sorry to hear that. First point, at what age you develop heart attack matters. The family history matters. Try to get your HbA1c low, try to get your blood pressure control, try to get your LDL all the way down to 40 to 50. These are all things that you can do to keep yourself free from other future heart attacks. Number one. Number two, keep yourself walking, count your counts of steps, minimum of 7,000, nothing more than 10,000 is needed. Have a watch on your weight. Definitely, most of the patients after heart attack lose weight because of fear and taking pills, reducing their calories. It's normal. Don't be so anxious about losing weight. It's going to help you a lot. Food, eat less. Don't take more than 80% in lunch. In general, 70% in dinner is good. Breakfast is good. 50% dinner is good enough. I usually say our body is not meant for taking three foods. I would say two food is good enough.
So do you recommend that we should like constantly be in a calorie deficit, meaning like we should be losing more calories than we are
I'm not
gaining?
telling not calorie deficit. If you're not, unless you want to lose weight,
Mhm.
if you are in the mood to lose weight, yes, you should be in calorie deficit. If not, keep a calorie check. Don't take excess of calorie that is not needed for your body.
We have another question. Someone asked, doing exercises in an empty stomach in the morning, is it advisable for a heart patient who has already had an attack?
Unless you are a diabetic, doesn't matter.
Okay. Another question someone asked, how frequently do we have to check heart health, like once we detect heart problems? Like how often should we meet with
That
the
depends
doctor?
on the severity of your heart problem. If it is a mild problem, we used to call once in a year. If it is a severe problem, but you are not undergoing any procedures, then we used to call quite frequently, like once in a month or 3 months.
Mm-hmm. Okay. Um, do you want to talk a little bit about the specialized procedures that you do as an interventional cardiologist rather than like with, because I know that you don't do like open heart surgery, and also do you want to talk a little bit about that?
Yeah, great. So I'm not a surgeon. I am an interventional cardiologist. I give less pain to the patient and more pressure. We don't open the chest. We go through the vessel, small vessel in the hand called as radial artery, or in a big vessel in the leg called as femoral artery. Without opening the chest, we go and replace the aortic valve, nose aortic valve. If there's a problem inside your valve, we balloon it to open it. If there is a problem inside a blood vessel that carries blood to the heart muscles, we go open the blockage and put a stent.
So I know that you do this one procedure called TAVI, I believe it's called. Can
Yeah.
you talk about that maybe a little bit?
A TAVI is a boon to human being because previously, for the last 50 years before 2002, we used to open the chest and then stop the heart, replace the valve.
Mhm.
Now we go through the leg called as femoral artery, cross the aortic valve with the wire, and then deploy the valve in a particular position.
Oh,
So
okay.
that
So it's what.
patient gets admitted today, gets the procedure done
Mhm.
tomorrow, and goes home day after. And at
Mhm.
the end of 10 years, it has been shown that open surgical valve, TAVI is equivalent to open surgical valve. We are happy with the results.
Okay. So do you want to just talk a little bit about kind of your uh experience like becoming a doctor, maybe like what influenced you to become a doctor and kind of that long process of like
So
what you've
I'm
done?
an average, regular Indian school kid who knows only engineering and medicine. I was inclined towards chemistry. My parents are inclined towards medicine. I got both. I was not. It doesn't mean I didn't. I hate both the thing. I was having equal inclination. And at 16 and a half years, you can't expect me to take my profession. So I listened to my parents, and they are definitely going to help me. I trust them. So I am a doctor now. I'm doing good. Now, if you looking back, if I go retrospectively to 1999 when I finished my plus two, I don't think I will take anything other than medicine.
So how has that after doing
MBBS
like
is my
the.
parents
Mhm.
without any kind of interference from me. And after that, I finished my MD. There, I have to put my because I initially want to become a surgeon. Then I went into OT. I was standing for 5, 6 hours, 7 hours, 8 hours, and I told no, this is not my job. They are cutting, hitting, and all nothing. I need to think. So I wanted to think and make differential diagnosis and treat accordingly. So that's a book by name Harrison in Internal Medicine that helped me a lot. After reading that book, I thought, no, whatever it is, I'm going to become medicine.
Mhm.
Then I did my medicine in one of the very good universities in India. It's called as Postgraduate Institute of Medical Education and Research, Chandigarh. There I got the passion of becoming I had during medicine, I thought I will be either become a kidney specialist or a critical care physician or a cardiologist. So in emergency, when I was posted in emergency, there was one patient who presented with life-threatening arrhythmia called ventricular tachycardia. The heart rate was 300. So I cardioverted the patient with shock. He became normal. He sat up.
Mm.
Then there was another patient who presented with heart attack. There we gave a drug which got clot buster, thrombolysis. Then he became pain free. Then I realized, okay, this is the specialty which I want to do. I can see the benefits immediately. It's a kind of short dopamine, but the sweet, pleasant dopamine. So I
Yeah.
like it. That's it.
Mhm. I think we just had some new question. Someone asked, do medicines for heart health and blood pressure have side effects? And if so, what type of side effects will
So
they have?
none of the drugs comes without any side effect. All of them have got some side effects. The side effect profile of one drug varies from another. It varies from one patient to another patient. It has to be, or more, all your doctors will assess for the side effects. Do not hesitate to take the drugs because those drugs have got side effects. None of the doctors will prescribe the drugs without knowing those side effects. They know, but in spite of knowing it, they give it. That means there's a reason for it. You can ask your physician. That's it.
Okay. So I know that you did a lot of like fellowships here in like US and also in India. Do you want to talk a little bit about like what each fellowship was for and how specialized you are in cardiology?
Yeah, there is no fellowship program 12 years before when I finished my cardiology from All India Medical Center in New Delhi. As a kid, during Chandigarh training, I always wanted to go to US. Those feelings still is there. That's a different story. Uh, so during my MD, because of few family reasons, I could not go to US. So I did my DM from Delhi, and then that it's called studying abroad. It's a kind of itch. You have to scratch it. So I could not stop it. Then I persuaded. It was quite difficult to get. I was lucky to got myself trained in Sinai, Mount Sinai, New York, where we do a lot of complex procedures. I got trained from pioneers like Dr. Annapurna Kini, Dr. Shami Sharma, Dr. George Dangas. Most of them, all of them helped me a lot. I'm here intervention just because of them. And I did my structural program again. I went back, joined here as an associate professor, assistant professor, associate professor. Then I went back again to do my structural fellowship so that I can learn how to place a TAVI valve through the legs. Came back again to India. I'm happy to give those services to my patients here.
I think we have a new question in the chat. At 40, what is the must test to measure the wellness of like this heart strength? Like, is there any
40 minutes
test?
must test. Yeah, I would say check your cholesterol other than HbA1c. Check your blood pressure. Check your creatinine level. Check your creatinine level, and then check your liver function test once it is needed.
Okay, I think we'll wrap it up here. Thank you so much, everyone, for attending this meeting. If anyone missed any parts of it, I will put a recording. I will send the link where the recording will be. So if you go to this website, you'll find the link by the end of tonight. Thank you so much all for attending. And we likely will be having another meeting soon regarding diabetes and endocrinology. So I hope you all will be able to join that meeting as well. Thank you so much, everyone. Have a great day. Thank you, Dr.
Thank you,
Boopathy, as well.
Priyanka. I sincerely apologize for being late.
That's
Catch you
totally
soon.
okay. I understand. Thank you.
Thank you. Thank you, everyone. Thank you. Bye bye.
Thank you.
Mhm.